Good morning, everyone, and welcome. Thank you so much for joining us for this webinar on Best Start for Life and Family Hubs. It's so brilliant to see so many of you here this morning. I'm Julia Mays. I'm the Program Manager here at the National Centre for Family Hubs, here at the Anna Freud Centre. So just briefly for anyone who's joining us today for the first time, the National Centre for Family Hubs is an online resource and learning network, which has been funded by the Department for Education and is being led by the Anna Freud Centre, the UK's leading evidence-based children and families mental health charity. The National Centre is designed to support the development of family hubs and to spread best practice across England, taking into account what families say they want and need, what providers tell us about best practice, and what we know from evidence about what works. Today's webinar is part of a rolling programme of learning events hosted by the National Centre, and recordings and resources from all of our previous events are available on our website. Today's event will be exploring how family hubs can support the delivery of effective Start for Life services during the critical 1001 days, and is being delivered in partnership with colleagues at the Department for Health and Social Care Start for Life unit. We have events also scheduled for February on youth and family hubs, and then a busy March with 3 events taking place on service design and commissioning, using behavioural insights to increase the reach and uptake of family hub services, and exploring how family hubs can improve the lives of children and young people with special educational needs and disability. You can book your place at any of these events via our website, and we'll share a link to the booking page in the chat now. You can also join our Family Hubs in Mind Learning Network to receive our newsletter, where we'll share details of all future learning events and resources. Supporting the early years of a child's life with particular attention to the first 1001 days is crucial to the Family Hubs model. Prioritising an open and accessible environment of support that helps parents and carers through the antenatal period to their first interactions with their baby or infant is crucial, and we know just how important these earliest experiences are for later life chances. We're joined by a brilliant lineup of speakers this morning to explore this topic. We're going to start with an update on the work of the Start for Life unit from Dame Andrea Leadsom. Colleagues from the Early Intervention Foundation, who are our evidence partner here at the National Centre for Family Hubs, will then provide an overview of the evidence on the importance of the first 1001 days to child development and what we know about delivering integrated maternity and early years services. We'll then move on to a panel session to explore some of the learning from local areas developing family hubs with colleagues from Blackpool, Doncaster, Isle of Wight and Westminster. And we're then going to attempt a bit of an interactive collaboration exercise led by the Start for Life unit to explore the services within the universal offer as envisaged by the Best Start for Life vision for the 1001 critical days, and what could be delivered through family hubs and how. If you have any questions or comments, please do pop them into the Q&A, and we'll try to bring these into the discussions where possible. But anything that we don't get to today will be collating as a list of frequently asked questions, which we'll make available on our website, and we'll be building it into the further development of our Best Start for Life and Family Hubs module in our implementation toolkit. You can also get in touch with us via email with any questions or comments. It's a pleasure to now introduce Dame Andrea Leadsom. Dame Andrea has been the Conservative MP for South Northamptonshire since 2010. Between 2014 and 2020, Andrea served in several government roles, including as Economic Secretary to the Treasury, Minister of State at the Department of Energy and Climate Change, Secretary of State for Environment, Food and Rural Affairs, Leader of the House of Commons and Lord President of the Privy Council, and as Secretary of State for Business, Energy and Industrial Strategy. Andrea has championed the importance of the 1001 critical days for over 20 years. She was the chair of the Oxford Parent Infant Project from the late 1990s and founded the national charity PIP UK in 2012. In Parliament, she has established the All-Party Parliamentary Group for Conception to Age 2 and the 1001 Days Critical Manifesto. And whilst the Leader of the House, she chaired the Interministerial Group on the Early Years. She's currently Chairman of the Early Years Healthy Development Review, appointed by the Prime Minister in July 2020. The review launched the vision for the 1001 critical days in March 2021 with its recommendations to make sure that every child gets the best start for life. Andrea, welcome back to the National Centre for Family Hubs. And thank you so much for taking the time to join us today. Over to you.
Great to be here. Thanks so much, Julia, and welcome everybody. This is such an exciting project, and it's been fantastic to work with the Anna Freud Centre so far on trying to articulate what the Family Hub model should really look like, but very specifically, what incredible support Family Hubs could provide to make sure that every baby gets the best start for life. So just to set a bit of context, if I could have the first slide, please. What we all know, what is absolutely irrefutable, is that the period from conception to age 2, the first 1001 critical days, are vital for an infant's development. It's during that period that human beings learn to regulate their own emotions, to be confident, to feel that the world's a good place, to be interested in the world around them. It's a time where families bond. It's also, conversely, a time where quite often up to 30% of domestic violence starts during pregnancy, where parents might really struggle with postnatal depression or with breastfeeding or with health-related issues, or just generally the pressures of being a new parent. So the 1001 critical days are a vital time, not just for babies, but for those who care for them too. It's a chance, if we get it right, to really improve our society for the better. And as you can see on the top left-hand side there, the best start for life, that beautiful document full of wonderful parent and carer and baby pictures, just worth looking through just for those. That actually sets out the work that the Start for Life unit did between July 2020 and March 2021, culminating in this new government policy around the best start for life, a vision for the 1001 critical days. As you can see, we had a huge amount of engagement, mainly with parents and carers, but also deep dives into what kind of services work, what evidence there is. We took lots of advice from academics on how you could best measure the impact on the social and emotional development of babies to improve the services that we provide for them to give every baby the best start for life. And really, fundamentally, the key thing to take away from this is that what is at the heart of all the best start for life work is putting the baby at the center of everything. Not the convenience of the workforce, not even the health and well-being of the parents and carers, but putting the baby at the center of everything. So we came up with 6 key action areas that are now government policy. The first 3 action areas are around how the system is going to support families much better. So what families will see that is different for them. The second 3 action areas are how to make things work better for parents and carers. So if I could have the next slide, please. Action area number 1 is absolutely what every parent and carer told us, and that is that the support they get is not joined up. They don't know how to access it. It's often not available when they need it. So action area number 1 is about providing seamless support for new families. What we want to see is that every single family that's expecting a baby or adopting or fostering a baby receives a set of seamless offers of services. And those universal services should include midwifery, breastfeeding, mental health support, health visiting support, safeguarding, disability support, and parenting support. And those universal services must be available for every new family. But in addition, of course, there are so many other services that families need, ranging from debt advice to couple counselling to smoking cessation, domestic violence reduction, all of the kinds of extra services that local authorities and public health departments offer so well. And yet at the moment, the feedback from parents and carers is they're not joined up. So we're working with lots of different government departments and with the voluntary and the charity sector to make sure that every local area will provide that joined up set of Start for Life services for families in the future. That means printing a page so that every person who goes to their GP or their midwife or to their family hub can be shown, here is the Start for Life set of services and here's how to access them. So then next slide, please. Action area 2 is all about what we're talking about today, and that's the welcoming hub for the family. The family hubs, yes, physical spaces, but also a family hub model. And this is absolutely intrinsic to the Best Start for Life. And what we're saying is that every family hub of any size must offer the Best Start for Life services within its 4 walls, and not just within its 4 walls physically, but also virtually and through outreach. Now, we know that what parents and carers want is for every family hub to be open access, so any family with a child can go there, and universal, so open to everybody. You don't have to be waiting for an invitation, you don't have to have an appointment, you can just drop in. And in that family hub, what we really want to see is the Start for Life services available, so that you can go there from birth registration to seeing your midwife, to talking to your health visitor, to having a cup of coffee, talking to other parents, accessing a parenting program, perhaps on the television with a group of other parents, facilitated by a midwife or a health visitor. So a welcoming hub for families, very importantly, a physical space, a virtual space, and an outreach space. So that's action area number 2. Action area number 3, next slide please, is all about information for families when they need it, how they need it. We've met with lots of fantastic charitable apps that provide support for families. We've met some fantastic web chats that are provided by local authorities or by charities to provide 24/7 support for families when they've got a question or they're worried about something. We know NHS 111 does some great work with the perinatal period, but can be even more improved. And very importantly, we're also working with colleagues in NHSX to look at a digital version of the Red Book. So that plastic red book that everybody gets for their baby at the moment, and then most of us lose in the fullness of time, but actually something digital that enables families to keep a record of their baby's development goals, and very importantly, enables early years professionals to also be able to provide joined up services for families. So that's action area number 3. Next slide, please. Number 4 is all about the workforce. We hear from the workforce that they would like to receive more training. They feel very under pressure. Their caseloads are too high. What we're looking at through a trial is mixed skill workforces, new routes into the workforce, perhaps with apprenticeship nurses, breastfeeding support workers, early years practitioners, but working very closely with key stakeholders to make sure that families can receive a key contact, so somebody who will be their go-to person to help them to find their way through the services that they need. So action area number 4 is a longer term piece of work, working closely with the early years workforce. Next slide, please. Action area number 5 is about outcomes measurement. If you don't measure it, you don't care about it. We know that some of the data in the early years is not very well recorded, and therefore it doesn't enable local authorities to be able to continuously improve their Start for Life. So what we want to do here is to make sure that we are measuring what counts, that we're measuring attunement, development goals, breastfeeding initiation and continuation rates, the statistics around couple breakdown and so on, so that we can actually put in place a plan for continuous improvement. And we're also looking at inspection and regulation, light touch, and working with local authorities to discuss what could be done, but also engaging with local authorities to look at a new innovation, which is parent and carer panels, i.e. TripAdvisor style feedback from parents and carers on what went well for them, what didn't go so well, what they would like to see differently. So actually continuously improving the Start for Life offer. And then action area number 6, incredibly important, and that is leadership for change. So at a national level, the Prime Minister has said that he will appoint a cabinet member with oversight for the Start for Life. I continue to chair this work until the end of April, but at that point, we expect to have a cabinet member who will champion this work at the national level. The Start for Life unit will continue to work from the health department, a team of 25 brilliant, committed civil servants with a huge range of skills and experience. And then at the local level, again, we're working with different stakeholders to identify the most appropriate local leader, a single accountable leader who can work in their local area to bring the health and the local government services together with volunteers and charities to provide the best Start for Life offer. And of course, vitally in Action Area 6, we're also working flat out to prove what works, to make sure that we can secure further spending commitments from government to continue to transform the Start for Life services. So those are our 6 key action areas. There are 29 individual actions within that, but I thought I would just finish up with a quick update on what does this mean for family hubs. So as you will all know, next slide please, the family hubs are designed to be universal and open access from a Start for Life perspective. Maybe not for older age children. That's where the Anna Freud Centre are doing sterling work in articulating the lifelong family hub. So for children from conception to the age of 19 or 25 where there are disabilities. But our focus is on what should it look like in that critical 1,001 days. And what we have articulated is, as well as being universal and open access, families want a place that they can go to that will welcome them, that will provide them with the services and the support they need, from birth registration to antenatal checks to meeting their health visitor. But in addition, what we heard from parents and carers in the COVID lockdown is that actually they found the virtual services to be incredibly important. So particularly dads have told us that they would much rather talk about their own mental health problems online than face-to-face. We know that for some parents, actually getting up, getting a toddler and a baby out the door, showered, breakfasted, down to the family hub is very tricky. They would prefer to go online for a parenting class or to talk to their health visitor. So that virtual services are very important. But also outreach. Health visitors always go to people's homes to check them out, to talk to parents and carers, find out how they're feeling. And many other volunteers, from breastfeeding support workers to family centre workers, will go to people's homes. So physical, virtual and outreach services are all a key part of our vision for the best Start for Life for every single baby, putting the needs of the baby at the heart of everything we do. Thank you very much for listening.
Thank you so much, Andrea. What a lovely note to end on. And it's great to hear how the work is progressing. There's certainly lots going on. I'm going to hand over now to Dr. Kirsten Asmussen, Head of What Works Child Development, and Ben Lewing, Assistant Director, Policy and Practice at the Early Intervention Foundation, to take us through the evidence. The Early Intervention Foundation are our evidence partner here at the National Centre. We're really looking forward to hearing your talks this morning, Kirsten and Ben. Over to you.
Great. So I'd just like to start out to say how excited I am to be presenting at this webinar, and how excited I am to have been asked to participate in this very exciting initiative. And also just to talk about how important the first 1,001 days are. But before we go into that, I'm just going to give you a quick overview about the Early Intervention Foundation and what it is that we do, and why this period is so important for us as an organization. First, to just start saying that we are one of a growing number of What Works centres in the UK that are part funded by the UK government to really critically examine the evidence underpinning what works for various services. For the Early Intervention Foundation, this means doing, what we have now, a very growing series, numbers of reports that have critically examined the evidence in specific areas of children's development. I've got 6 reports up here on the screen, but it feels like we are adding to these reports certainly monthly, if not now weekly. So please check out our website to see what we have. The 6 that are here are particularly relevant for the topic that we have today. But also I should say that we don't stop with reports. We are working continually, as Ben will describe, to disseminate the findings of these reports so that they can be used particularly by commissioners of children's services and practitioners in local areas, as well as policymakers and other stakeholders with an interest in children's early development. One of the things that we do is we critically examine the evidence to make sure that what we are reporting on is the most robust evidence. And I think that we have all become more appreciative about how important good evidence is in the wake of the coronavirus, because we want to make sure that we're getting the vaccines. This is true of the interventions that we offer children and families as well. So we go through a very technically difficult but also rigorous process to determine how strong the evidence is underpinning the messages that we share with our audiences. When it comes to early intervention, what is it that we mean? Well, of course, today it's quite clear that the earlier the better, right from the very start of conception. But more broadly, we'd like to consider it as at any point in a child's development, both as a form of prevention, but also from keeping problems from becoming worse. So we can be talking about the youngest child, but we could also be talking about older children, children of all ages. Early intervention is important. And this is because studies consistently show that when you provide the right support at the right time, you can provide important benefits in 4 essential domains of children's development. I should emphasize here that these domains are highly overlapping, but we consider them conceptually different. And so, for example, support in the physical domain will help children avoid obesity in adulthood and increase their physical health. Support in the early support in the cognitive domain will prepare children for school, and also in the longer term help them enter the workforce. Support in early self-regulatory or behavioral skills can help reduce their involvement in crime and antisocial behavior during adolescence. And support in for social and emotional development should help with their mental health and well-being throughout the lifespan. So why are the first 1,001 days critical and important? You know, it's funny, I was thinking about this question, and it's for many, it feels very obvious. I mean, look what's happening here. We have at the point of conception, we're talking about a handful of cells that split and develop into a child at the age of 2 at their second birthday, who is very much an individual who can walk, who can talk, who can communicate their needs and form positive relationships with others when everything goes right. It is an absolutely astounding process that we take for granted. It is a robust process, but it also needs assistance from the child's parents and also society more generally. I think it is fair to say that development is at its fastest during the first 1,001 days. And also what happens during this period in a child's development lays the foundation for all future development. Basically, during the antenatal period, many processes appear to take place quite automatically. Of course, there needs to be some antenatal process support in place through the mother's nutrition and the lack of stress to make sure that this takes place as it should, but it is more or less an automatic process under the right conditions that provides the child with a set of capabilities, perceptual capabilities and reflexes that really form the building blocks for all future learning, as well as developing positive relationships with others, acquiring language, and learning how to regulate behavior. Some of you may have seen slides like this before. These are dendrites in the brain. The first 1,001 days are a period of what we call intense neural plasticity. So here you see on the left side the neurons that are in the brain and relatively crude dendritic branches. These are best analogies, perhaps a tree, but quite rapidly these neurons grow, they duplicate, and they form connections with each other. And in fact, a child during the first 1001 days has more neurons at the end of that period than an adult does. You can see that they're growing and they're developing and they're connecting with each other. So by 24 months, you have quite a few connections there, but you also can start to see on the far right side how they are supporting each other. And what happens then after the first 1001 days is that those connections become much, much more stronger. And quite often this plasticity is automatic, but it is shaped, fundamentally shaped by the child's environment. So we can talk about processes that we refer to as biologically primary that happen with little support from the family. But what's so important is the biologically secondary processes that are shaped by the parents and the child's community and the broader society. So I'm going to give, as a point of analogy, the idea of a child learning how to tie their shoe. And in fact, this would not happen during the first 1001 days, but you're preparing the child for that. As a personal note, I recently became a grandmother, and yesterday as I was preparing these slides, my son got in touch to tell me that he was so excited that his 8-week-old child, our grandson, can pinch. And pinching is actually a reflex that the children have. It comes from the grasping reflex. It comes very early. That is a biologically primary process. But of course, children need to learn how to use that pinching reflex to help learn things like tying their shoes. And tying their shoes is actually a very cultural dependent process. If you look here, you can see that the mother is helping the toddler tie her shoes in a way that is appropriate for the circumstances that she's living in. Obviously, the wearing of shoes is different in other cultures, and this is really where parents, in the first instance, and certainly during the first 1001 days, shape how those primary processes are used. In the famous words of Donald Winnicott, most parents are very good at this, or at least good enough. And I think what I find amazing is that by and large, they don't need an instruction manual. They know how to do many of these things naturally. But some parents need extra help. And I think it's fair to say that all parents will need help at some point or another in their child's development. So it's very, very important that that help is available when parents need it and as they need it. And when that help is not available, gaps can emerge in children's development very early on and persist. So it's important to get this correct right from the start. Otherwise, it's much, much more difficult to rectify that situation. This is why family hubs are so important for making this help available. Parents should not have to go it alone. And I know that during the pandemic, many parents have felt that they have had to go it alone. And that makes it particularly difficult, not only when you need that extra help, but you don't know where to find it or who to turn to. And when you do so, you feel stigmatized or alienated. This is just a handful of the services that we know are important for children and families during this period of development, healthcare, including both midwives and health visitors. And I've highlighted family hubs here because not only will it be an important service in its own right for these families, but the fact that it will be a nexus for all of these other services is really quite exciting. I was also very happy to hear Andrea highlight how these services will not only be physical, but also virtual. I think one of the maybe silver linings of the pandemic, if we can think of it that way, is that it's highlighted the uses of virtual environments and how important they can be. And I think that the research evidence, although it is a bit preliminary, is showing that virtual is the new normal. And it is also less stigmatizing than some of previous services and much, much more accessible. And so this is a very exciting time for family hubs to be making use of these new technologies that can really help families support the needs of their young child. Finally, I just want to end by saying that family hubs will really achieve what they're intended to achieve with ongoing policies, and having universal authors are part of that. So I've highlighted this here as all the other sorts of societal sorts of issues that do make a difference. So once again, thank you for inviting me to talk, and I will now hand over to my colleague, Ben Louie.
Right, so hello everybody. As Kirsten has said, my name is Ben Louie. I'm an assistant director at the Early Intervention, and I lead our portfolios on early years, reducing parental conflict, and I also have a particular interest in multi-agency working. I'm really pleased to be here today. Sustaining a focus on the first 1001 days within family hubs is hugely important, and Best Start for Life is the ideal vehicle for doing this. My job today is to talk to you about how EIS review in 2020 offers insights into how early childhood services can develop as part of the family hubs agenda. So for context, briefly, the review looked at contemporary local practice and existing research on children's centres and hubs. We worked with 14 local areas across England and conducted a rapid evidence review. The broad headline findings were a lack of evidence on delivery and effectiveness, a lack of consistent ways for specifying and evaluating different approaches, increasing links between early childhood services and the wider network of whole family services, and a growing focus on more targeted support. And we also found that local areas are ahead of the curve as far as evidence is concerned. So they are experimenting and innovating and getting ahead of some of the more robust evidence. And finally, we found that progress in using evidence-based programs seemed to be at risk due to financial pressures and also a lack of local evaluation. But actually, I don't want to talk about the key headlines that came from that report. I want to talk to you about what sits beneath them, which directly relates to how local areas deliver early childhood services as part of family hubs. And I'm going to look at four things. First, the approach of specifying early childhood services within family hubs. And then the learning which is relevant to the three pillars or delivery areas that the Department for Education used to define the National Family Hubs model. So that's access, connection, and relationships. So first of all, the spec, or specifying the local approach. The review set out how the most robust interventions and approaches are underpinned by a clear rationale, supported by evidence for why they are needed, how they will work, and what they're intended to achieve. Essentially, a theory of change. If we are to understand the effectiveness of different approaches to delivering early childhood services, then we need to be able to specify what they're for and how we will measure both delivery and impact. Some of the local areas in our study had a defined approach that was driving their local planning and delivery of early childhood services, but that wasn't the case for all. In fact, local areas that we spoke to described a variety of local approaches, but often without a common language to clearly explain what they were trying to achieve, and they didn't have consistent metrics to measure its effectiveness either. Local stakeholders did talk about different kinds of approaches, different purposes for what they were doing that ranged from saving money to matching community needs and a whole range of things in between. Some suggested that family hubs were likely to offer benefits to school-age children and young people, but at the cost of a diluted perinatal and early years offer. Now, this may be a risk, but it isn't necessarily the case because there were plenty of other areas that identified real benefits, such as whole family working, more efficient use of physical buildings, and a positive sense of revival that was brought by having children of all ages using children's centres and hubs, helping the local area to move on from a narrative of funding cuts and service restructuring, so a positive sense of revival. The principle of clearly specifying the local approach now underpins the new Family Hubs development process, which you may have seen. Its 3 stages involve engaging stakeholders with the data and evidence, building a local theory of change, and planning for implementation. Now, in particular, it starts with a local system assessment to show how well services are working together in the local area. using tools like the Early Help Systems Guide or a maturity matrix, or indeed the planning tool for reducing parental conflict. It also includes population needs assessment and an analysis of other existing local and national evidence and research. You can find out more about the development process on the National Centre for Family Hub's website. Now I want to draw out some of the messages that relate to the DFE's 3 pillars, starting with access. The review helps to answer 3 main questions, which I'm going to work through in turn. The first is, when we're talking about access, who are we talking about? The local areas in the review stressed the particular importance of making children's centres and hubs available to all in the perinatal period. Important for building relationships, screening vulnerable families, and building on family strengths. Open access was seen as a key facilitator of this. The emphasis was on establishing trusted relationships, which were key also to reaching those who are most affected by inequality, and sustaining involvement for those who could benefit from more targeted support programs. So that important balance between universal and targeted. Local areas described how the contact needed to be meaningful if it is to establish the right kinds of relationships, so avoiding limited, superficial, or selective interactions. Again, a focus on relationships rather than transactions. Local areas also talked about the importance of prioritizing investment in evidence-based targeted interventions, particularly those that had a demonstrable impact on preventing family breakdown and statutory intervention. In fact, the overall message coming from across areas was consistent with Marmot's principle of proportionate universalism, which still seems to be influential in the thinking of many local areas. The second question is, what facilitates access? Children's Centres research suggested that engaging families is done most successfully when understanding access not as a one-off, but more as a sustained continuum of access. Again, a relationship rather than a transaction. This continuum includes building awareness, good first contact, sustained engagement with parents, and connecting parents to the wider context so that they can get involved in other services. Other key messages from the review which are relevant relate to facilitating access, which responds to how parents see the world, understanding their perceptions, concerns, and motivations, and having explicit approaches which focus on access by those most affected by inequality. So understanding the different population groups that are served by a family hub or a children's centre, including those for whom English is not a first language and minority communities, and reaching out to vulnerable groups in a way that supports their engagement. The final question on access that the review helps us to consider is access to what? Local areas described the importance to joined up early childhood services of 3 things, and you'll start to see the themes coming through the presentations that you've heard already. So the first point they made was retaining some physical estate as a focal point, buildings as a focal point, while recognizing that locating physical centres in disadvantaged areas did not necessarily mean that they were used in an inclusive way. So they're not the answer to everything, but they do have an important role to play. The second was designing support around families rather than agencies. So making sure that services were available when families needed them, at evenings, at weekends, in community venues, and clustering the delivery of services where families go rather than expecting families to come to the service. The key thing here was focusing on the relationship rather than the venue, and thinking about where families could best receive a service. As we've heard already talk about digital delivery and outreach. These were important messages from local areas in this review too, delivering support in the home and making good use of modern technologies, including social media. So a blend of different approaches which suit families with different requirements. The second DFE pillar is connection, which covers how services and professionals work together in joined up or integrated ways to improve the service experience for families. Now, the review found widely varying local arrangements for integrated working, from at one end, a high degree, to another end, not part of what is done. There was rich learning which is relevant to early childhood services in family hubs. Local areas talked about the following as key to greater connection: developing multi-agency support pathways and child journey maps to improve access and reduce service handoffs, clear protocols for data sharing, taking time and building relationships, and building this sense of a shared workforce culture through joint training and continuing professional development. Although co-location was described by some as helping, it was generally seen as not an essential ingredient, more suited to some physical locations than others, and less important to integrated working than delivering interventions together and sharing family data. We found that research has a lot to say about the ingredients of integration, but little about the impact of integration. It did suggest that key readiness features, including those identified by local areas, but there were others too, such as a history of previous effective partnerships and collaborative arrangements, leadership which transcends traditional professional boundaries, being clear about the aims, objectives, and outcomes, and interestingly, processes to manage ambiguity and conflict, promoting trust and containing anxiety between partners. This isn't a simple process as you move from one approach to another. So recognizing ambiguity and conflict is seen as an important part.
Ben, sorry to interrupt, just one more minute. Thank you.
The final pillar then for relationships is relationships. I've touched already on the importance of a combined, universal and targeted offer for building trusted relationships, and how learning on family hubs can play a role in supporting healthy parental relationships is for another time. But the review did have some messages about the kind of workforce development which builds relational approaches, which includes matching workforce skills and experiences to population needs, strategic oversight for workforce planning, and shared learning and training across agencies. The majority of local areas talked about the importance of relational practice and a people-focused culture. So there is much to learn and apply from the experience of delivering children's centres and hubs, which is both specific to early childhood services, but also crucial to the wider development of family hubs. In fact, the success of family hubs depends on this learning and experience. Thank you.
Thank you so much, Kirsten and Ben, and congratulations, Kirsten, on becoming a grandmother. Excellent presentations, which I think take us nicely into our next session, where we're going to explore some of the learning from local areas developing family hubs. So I just wanted to welcome our panel members, Vicky Walker, Development Manager in Blackpool Better Start, Sue Davies, Early Days Team Manager in Doncaster, Carly Bain, Service Manager in the Isle of Wight and the Regional Lead for Family Hubs for the South East, and Holly Holmes, Strategic Transformation Lead in Westminster. Thank you all so much for joining us. I'm going to ask first about access. And I wanted to ask, how do you facilitate engagement of families with your local family hub as early as possible? And how does this help to promote the principle of universality of family hubs and prevent stigma? Can we go to you first, Carly?
Yes, of course. So on the Isle of Wight, we introduced what is now our family hub model in 2015, and our real focus was around health provision, so our midwives and our health visitors. And so since the implementation of the hubs, we've had those health professionals working out of our hub buildings. So expectant parents at around 6 to 8 weeks pregnant attend our hub buildings at the earliest possible point so that they get used to the building itself, the setting, the surroundings, the opportunities, the things that they can access as parents. So those initial appointments and then the subsequent appointments take place within the buildings. As they come in, they meet our volunteers, our family support workers. They can see the buzz of all of the diverse opportunities and groups going on. So that was crucial for us. It was about making sure that our health services, right from that initial midwifery appointment, were taking place within our hubs.
Thanks, Carly. Or if we can go to you next, Sue.
Yeah, good morning, everybody. I think similar to what Carly was saying, Doncaster Family Hubs have been developing for quite some time now, over about the last 5 years, and midwives have worked in our hubs consistently over that time. So pretty much the same, really. Families get used to coming to the hub for a universal service that we know the majority of families do actually access. The team that I'm managing at the moment, we're just testing out a pilot project where we've got key workers that work alongside the midwives, our midwives and our health visitors. And when families attend for their midwifery appointment booking in, then they are allocated a named key worker. So that key worker supports some of that seamless transition, I think, as well to other services. Postnatal checks are done in the hubs as well. So as Carly said, families are used to coming along. They get an opportunity to meet our staff, to meet other staff, and to find out about the services that are available.
Thanks, Sue. And Vicky, how about in Blackpool?
I think just to kind of echo what Carly and Sue have said really about those opportunities within those early days, if areas can capitalise on that period of kind of that perinatal offer, it really supports both parents to access the hub. So in Blackpool, our antenatal programme, Baby Steps, concentrates on that dual partnership within pregnancy. And then afterwards, as kind of Andrea discussed earlier in her commentary, those birth registrations within the family hubs, as opposed to being in the centre of town, really support that engagement in those early few days. So when parents want the opportunity to talk about breastfeeding or infant feeding, for example, they've got those health services around them already, that midwifery, that health visitor offer. But then in addition, there's other members that are within those family hubs that can offer messages around public health and infant feeding. In Blackpool, as you know, Julia, we have got an army of outreach workers called community connectors, and they're kind of the driving force, I guess, that go into other community spaces that bring parents to the family hub. So they might be in doctor surgeries, the supermarkets, our parks, churches, any other kind of external community places, to just inform the community about what that family hub offer looks like, so that they can offer those services and access those services at the most earliest opportunity.
Thanks, Vicky. And I wanted to ask next about multidisciplinary service delivery and how you maximise the opportunity of family hubs to enable integration of multidisciplinary teams, and how you foster a sharing of skills and knowledge and information between multidisciplinary teams. Now, I wonder if we can come back to you, Sue.
Sure, yeah. I think for us within the family hubs, we've got an open door policy, not just for children and families, but also for other professionals. We're quite fortunate in Doncaster. We've got 12 family hubs, designated buildings, and we've got a number of outreach buildings that we can also work out of. I think there's been lots of talk about relationship earlier in the morning, and building relationships is kind of like the core of our business. So building the relationships, those open door policies. We have regular meetings with our partners, the wider partnership, not just health and midwifery, but all the other services that deliver children's services. We have spaces in our hubs where other professionals can come in, either just for lunch and a coffee, or come into work as well. And we work in other buildings as well. So I think that relationship and that open door policy, I think it feeds down, doesn't it? If we're building relationships with each other as practitioners and professionals, then we're gonna model that down to our work with families and children as well.
Yeah. And Carly, how about in Isle of Wight?
Yeah, absolutely. Much like building on everything that Sue said, we do similar on the island. We have a weekly multidisciplinary panel actually that attends the hub buildings. So that includes the local authority, Bernardo's as our commissioned service to deliver the family support. We have Health Lead, Education, DWP, so they all come together to have a look at sort of how we can meet the needs of those families presenting in our hubs and being referred through with early help. I think hubs, by their very nature and as they've developed, have naturally brought services together. It's about physical and virtual spaces for people to collaborate and share skills. So I think it's quite organic in terms of how that has developed through our hub model, and I'm sure it's the case for other authorities. In 2015, we commissioned out our parenting support service to Bernardo's. So obviously it's a national children's charity, so it brought with it a wealth of skills and experience, which was fantastic. And lots of joint workshops take place within the hubs and also virtually, such as breastfeeding workshops that take place with health visitors, midwives, and also our family support workers. So yeah, that's some of the things that we do, just to add on from Suze.
Thank you. And I want to bring you in here, Holly. How about in Westminster?
Thank you. And I guess I cover Westminster and also Kensington and Chelsea, and they're quite interesting because they're at quite different stages of their journey. So in Westminster, we've had family hubs for quite a long time, whereas in Kensington, it's a newer process. So it's been really sort of helpful to learn from some of the things that we've already done in Westminster, which there's definitely a lot of learning, as you would expect. Yeah, I think some of the things that I was planning on saying are very similar to what Sue and Carly have just said. But I think, having an element of co-location does really help. Like, it absolutely isn't everything, like Ben said, but it doesn't need to be. It doesn't need to mean that the hubs are everyone's base. But having some time in the physical buildings each week does make a huge difference. And if that can also involve sessions that are jointly delivered and sort of joint clinics and things like that, that's incredibly effective. Because we do know that families will often come in for something, but actually a load of different things are picked up through that appointment. So it's really valuable. I think where it's possible, we've not managed it yet, to have shared information. Recording systems massively helps. It's one of the things when we sort of speak to practitioners, they always want it. It's always kind of causing barriers. So if people are at early stages and there's opportunities to do that, I think that's really, really valuable. We also have a similar kind of multidisciplinary panel for any of the services to sort of bring cases to for discussion and referral onwards. That happens on every fortnight. And also an integrated leadership team within each of the family hubs. So there's one lead for each family hub, and that's of different organisations. But then there's an integrated leadership team that sit with them, with members from all of the different services, including our voluntary sector, that contribute to the hub, and they kind of make key decisions and decide, I guess, the direction of that hub. So I think that's really important for all organisations to have ownership. And I guess last thing is just trying to get the team as a group together as much as possible, and sort of across the different organisations, so having away days and things like that across the hub, so beyond each individual's organisation, but to make sure that everyone really does feel that partnership and sort of ownership as a real group.
Well, I wanted to ask you next about leadership and what you've talked a bit about it there, but what you think effective local leadership of Best Start for Life as part of family hubs looks like.
Yeah, so I guess continuing on from some of the things I was just saying, I think it is really important to have a clear lead for each family hub, and for that person to be sort of a local leader, to have real buy-in into the hub concept and the whole partnership concept, but making sure that also comes with an integrated leadership team that connects into all the different individual organisations that are involved. And I think there needs to be kind of buy-in and support at very senior levels at all the individual organisations, sort of particularly health ones, because they are such big organisations, and it leaves the kind of service managers on the ground always balancing priorities a little bit between their commitment to the hub, which they generally always have, and then their organisational commitments and priorities. So I think kind of the more senior buy-in there is, the better. And I think sort of probably an issue we have in Westminster and Kensington and Chelsea, which maybe wouldn't be the same in all areas, is we're often dealing with several health trusts, because we'll have a lot of, say, maternity trusts that our residents will be going to, because they'll be going all over London. So it's how to kind of balance those things with also it being a local service. So that's really key. I think sort of having that partnership sign up to the family hub strategies, and if there's a kind of wider early health strategy that sits behind that, with real commitments for sort of each of the commitments that are in that strategy. So really understanding for each individual organisation, sort of what does that mean for them and what's their commitment to that. And I think, like, especially if we're thinking about this as a 0 to 19 and sort of that whole family way of working, again, for there to be a real partnership commitment to whole family working, regardless of kind of the age focus of the practitioner. And I would say that's something, I think, if we're honest, is mixed in our family hub. Some practitioners absolutely embody that, and some do still kind of quite focused on, this is what they're bringing to the table. So I think, there's definitely for us further work that could be done on that. And I think it's a really kind of interesting area, because we know that whole family working sort of is the most effective.
Yeah, thank you, Holly. And I wanted to come over to you next, Vicky, and ask you to what extent your model currently incorporates community ownership.
We heard Andrea talking before around the importance, really, within that kind of Best Start for Life of those parent forums, those parent and carer panels. So in Blackpool, that co-production element and having that community ownership is something that we've really strived to try and get right. And we're certainly not at the end of our journey with that and enhancing the offer within the family hubs. But just to kind of give people an understanding of what that could look like, and if they're starting with their journey in their area, some of the things that they might consider. So our widest offer of co-production, and I'd suggest if this is a new concept to some people, to look at the report, because there's some really good kind of models referenced in there and ways of working that people might be able to start thinking about. Is our community voice register. So we've got 1,300 community members that are registered, and Andrea discussed earlier about the opportunity that COVID's brought around that digital access, I guess. So those 1,300 members engage in our widest offer of co-production. So they're sent regular updates via Facebook or email or text messaging that talks to them about local campaigns. So, most recently things like fuel poverty, opportunities to be involved in designs of a local park, for example, surveys or any consultation that we do. I guess in addition to that, we've a large proportion of the community that unfortunately don't have that digital access. So this is where our community connectors come back in into the mix. And they certainly over that period of lockdown, we're visiting all new parents that gave consent to doorsteps to have conversations about the services available within the family hubs, whether that be virtual or in person. But then in addition to that, talk to them about how actually they can be a member of our community voice and how they can give influence to delivery and design of services. So we've then got a smaller set of groups within the community that offer a panelling process to any of the work that we do. And as I kind of mentioned earlier, Better Start enhances the local authority's lead on family hubs. So any of the work that is conceptualised for our conception to 0 to 4 service must be approved by the community before we take it any further. And I guess for those people that are listening that are familiar with overview and scrutiny that sits within local authorities and often in our health services, actually the community are our most critical friend in this situation. And it's a tough group to go and present to sometimes, but absolutely valuable and key to make sure that we're getting this right and they're leading some of our services. What's attached to that is some budgetary models, actually. So because Better Start comes with a pot of funding, that's given us the opportunity to actually give money to the community to spend on services, universal engagement services. So they come and tell us through those panels, through the digital access and through the community connectors, what services they think might work in their area. And they're supported with a range of community professionals and hub staff to try and put those services on. So that might be cooking classes or walking groups or sling libraries, for example. But the next level of ownership is that we've been working with Street to Scale, and that completely gives the full award of cash and ownership to the community. So over the last 3 years, community members have been awarded 28 amounts of £1,000, completely in cash, in a bank account. They get a debit card to go and spend on the resources that they might need for these community groups. And we've really been surprised about what the community can do when you put that complete trust and ownership into the delivery of services. So a recent one has been a group of local men acknowledge kind of that physical and mental need that's maybe come out of the period of the pandemic. They used the £1,000 to buy equipment to promote and start up a local football initiative. And they've now got 80 men that are meeting on a regular basis, that are taking part in exercise and then local social get-togethers that has been completely led and delivered by the community. They've just basically come back and told us what they've done and asked us to promote it. So it's just a really good testament and a reminder, I guess, that if we put that trust in the community, they can offer services that actually we probably wouldn't be able to do.
Thank you so much, Vicky. And we've only got a few minutes left. So I just wanted to come back to you finally, Sue, Carly and Holly, and just briefly, we talked a bit earlier about whole family working, and I wondered if you could say briefly a bit about what you see as some of the opportunities and challenges of working with this extended age range in a family hub.
I can jump in quickly. So it's certainly a challenge. It's certainly something that we had to consider very carefully, and I'm sure other authorities have. When we founded our hubs, we were fortunate we had our Supporting Families programme, which was 0 to 19, our Barnardos, and some independent nurseries that focused on early years, the 0 to 5, as well as the 5 to 19 parenting team. So actually, as they merged, we realised we had a really strong skill set for the 0 to 19. One of the things that one of the hub managers mentioned to me recently was they said that some people had been working in the early years for so long they'd almost forgotten their previous work. So a skills audit for all of that cohort of staff and volunteers was crucial, because actually people had been youth workers before, adult mental health workers, lots of transferable skills or relatable skills to the whole family approach. Another key thing for us was evidence-based parenting. So we used the Family Links programme, as that's 0 to 19. And also investment in leadership was really important. So our leaders were trained very clear on the vision that we wanted to create. They again completed skills audits themselves and attended training around management of the hub models. And that was really successful, actually. It was just about the skills audits and the confidence mainly.
Yeah, have I got a couple of minutes just to kind of follow on from Carly? So some of what we do in Doncaster, we've got a localities model now. So that is a group of all the children's services providers across Doncaster, our Stronger Families teams, our social care teams, parenting and family support, including the family hubs and the private and voluntary sector representatives as well. And I think that's how we bring that skill mix together. So we have regular meetings where we can kind of share the work out, really. So we can, each agency can focus on what their specialism is. So family hubs might work with some of the younger children in families, but we might have our Stronger Families, Troubled Families staff work with older children or with adults. So we bring that skill mix together and then share our resources, our staffing resources included, to find the best person to work with that family, but bring that all back together as a collective in our localities meetings. We found that's the best way to work, really, so that, you know, and my team particularly, we focus on the first 1001 days. So we would work with parents and the new baby in the family, but where older children are in the family, we would draw on our partners to support with that work as well.
Thanks, Sue. And finally, Holly, for some closing comments.
Thank you. Yeah, I think I agree with most of the things that have just been said before. I think we really follow a lead professional model in the hubs here. So having that one professional who kind of owns that family's needs, regardless of whether they're young children or older children. It doesn't mean that they're the only one that works with the children within those families, but they kind of are the lead for all the children, regardless of if that's their expertise. And we know that works really, really well, and it's what families like. It isn't what happens across the board. One of the things we're introducing at the moment, and so we're really kind of in the thick of learning about it, is a new health visiting sort of intensive support program that will sit across our health visiting and early help teams. So something that is very integrated and will require sort of, for example, our health visitors to sort of own the needs for older children as well. And like Carly was saying, a lot of those health visitors will have previous skills of working with older children. It's just often that they haven't used them for a very long time. And actually, sort of in the process of setting up the team, because it is something that's new, we're putting in place quite a lot of training, because actually we need to be realistic that they're going to need that training to sort of get up to date again with those skills and the specific interventions that, you know, the evidence is now showing us we should be using. And also we're putting them sort of jointly together with our targeted early help team, so where that expertise in the older children is, so that actually sort of it allows kind of both ways, because our early help families our early help practitioners who tended, again, and it's just happened like this, it shouldn't have been, to take the older children, can learn from the health visitors and vice versa. And just having realistic expectations that, you know, although we're putting this new service offer in place and there's an expectation that, you know, each of them will be able to take any family, we're going to have to be realistic with how quickly that can happen, and just, you know, make sure that they're able to support each other in doing that at the beginning. And so it might be if, say, a health visitor sort of takes on a family that has a 14 and a 16-year-old, they're going to have to lean on that targeted early help practitioner support more, probably over the first year or so, whilst they kind of redevelop those skills and go through the training. But actually, it's something that people are really excited about, because it is so clearly what our families have told us that they want, and they don't want to be kind of telling the same story to multiple different practitioners, sort of even if it relates to a different child.
Thank you so much, and thank you all for sharing your insight with us. Lots of brilliant work going on and so much learning, and which can hopefully feed nicely into our next session, where I'm going to hand over to Start for Life unit colleagues now. Molly Hogan, Family Hubs Policy Lead, and Phil Dawkins, Start for Life Offers Policy Lead, who are going to lead us through an interactive session focused on universal Start for Life offer in Family Hubs.
Thank you very much, Julia. I think some slides are on the way, but for now I'll say good morning, everybody. It's such a pleasure to be at this session today, and to know that there's so many of you on this webinar. It really is fantastic news for us. I should say at this point, thank you very much for all the questions that you've been posting, and just to let you know that we've been collating these as we go, and we'll get back to you as soon as we can with the answers to those. So to introduce myself, I'm Molly, and I'm the Family Hubs Policy Lead within the Start for Life unit at the Department of Health and Social Care. I lead on implementation of the second action area in the Best Start for Life vision, which is for welcoming family hubs, focusing on the 1001 critical days.
Good morning, I'm Phil. I also work in the Start for Life unit. I lead on Start for Life offers, which is about implementing our vision for a universal offer for every family, and a universal plus offer to meet the needs of specific local communities. And I'm hoping this is going to work if I say next slide, Paul, channeling Chris Whitty, thank you. So here's our proposed structure for this session. So I'm not going to read all of this out, but in a nutshell, we want to use the last part of this webinar today to run an interactive session to explore the delivery of Start for Life offers through family hubs. So this is an important part of feeding into the wider work for the Department for Education on family hubs, and we are working very closely with them as we develop our thinking. So we have 25 minutes today, I hope, a little bit over time, and we really hope this to be a useful but also enjoyable interactive session with you. And obviously we want you all to be a big part of designing this work with us. And as we can't be in a big room full of post-it notes and nice snacks, we are doing the next best thing with an interactive session. So we'll have virtual post-it notes a bit later, but sadly you will have to provide your own biscuits. Next slide, please, Paul.
Thank you, Paul. So without further ado, Dame Andrea already updated us on the exciting progress made by the Early Years Review and the Start for Life unit, but we did want to briefly reiterate here that, as Andrea made clear, at the heart of all that we do as the Start for Life unit is the desire to improve the experience and outcomes of babies, parents and carers. And the 6 action areas and 29 actions that you've been taken through are all designed to make this happen. And this slide just has some examples of that. We found that the best way to achieve our aims is to put the baby and the family at the centre of our work and try and see everything through their eyes. So the session today is about finding the best way that we can do this through family hubs. In other words, how we can deliver the baby-centred transformational Start for Life vision through the Family Hub network. Next slide, please, Paul.
Thank you. So this slide is the overall ambition of the Start for Life unit. And this though is all about working together, and we want this to be as collaborative as possible with the sector. But we thought to start off, it would be helpful and useful for us in the Start for Life unit to talk about our position and how we want to help you on your journey. So I'm not going to read everything on this slide, but the key message here is that we fully appreciate that people have different starting points and are on their own transformational journeys. We want to support that work as much as possible. We recognise that the pandemic has had a massive effect on how local authorities and their partners deliver services. And we also recognise that the effects on parents, carers and babies has been substantial and is ongoing. And we can see that local authorities and their partners have been amazing. And we don't want to lose the valuable lessons in the innovative new ways of working that have arisen. And ultimately, this is about listening to you, the experts. We want to know about your local decision-making. We want to tap into your knowledge and your understanding of your population that will allow us all to focus on needs. And by doing so, ensure that we put the baby and the family at the centre of everything that we do. Next slide, please, Paul.
Perfect. So first off, at this point, it's important to say here that what's on the slide doesn't represent government policy as such. This is rather presented as an illustrative example to stimulate thinking for the interactive session that we'll run in a moment. This is because we need to be thinking about what all of this looks like in reality, moving from words on a page to actions on the ground, exactly as we've just heard from Carly, Holly, Sue and Vicky. And we really want your help in bringing this to life. The Start for Life unit believes that Start for Life service provision will progress as you go through your journey. And again, the excellent panel members just now have spoken about this in the Q&A. I won't read the whole slide, but we'll leave this up as we undertake the interactive exercise. This will be flash up on the Zoom screen as you move into our interactive board. Essentially, we want to know if it's possible for us to map out what that journey looks like for local areas and their partners. This slide uses infant feeding as an example. Infant feeding support is one of the 6 universal Start for Life services identified in the vision as something that every single baby and family should receive. To help, we think it's important to think in terms of what a Start for Life offer could look like at 3 different places in a journey, and what the service offer would look like in terms of physical, virtual and outreach formats. So to look more closely at the example provided here for physical services, you might see a progression of starting out with leaflets and brochures easily accessible in the hub, and the hub has a designated breastfeeding space. Then as this develops, family hubs provide a welcoming, safe and secure space for mothers to breastfeed and share and learn from other breastfeeding parents, and drop-in support groups are accessible to anyone who wants to join. And then finally, this could be strengthened as parents and carers have access to timely, regular and flexible one-to-one professional support through the family hub. And there's a clear suite of breastfeeding groups, drop-in support, information, and direct advice from parents, nominated midwife or health visitor. So this was just an example of that particular element of the service progressing, enhancing as one might go through a transformation journey. And then the next slide, please, Paul.
Cool. Thank you. So using this concept we've just introduced, what are we here for? Well, we need your help. So you can see, we're already in Miro, actually you can't see, but you'll see very soon that we're actually already in the whiteboard space. So this Miro is an amazing, we hope, interactive tool that you'll find useful. We want your help with mapping service provision against using virtual post-it notes on whiteboards. You'll see in a second, we've set up 4 tables for 4 services, and those will include 3 example progression stages and the headings for physical, virtual, and outreach. And we'll run through these in a second so you can get familiar with them. But briefly first, I want to say that you've already heard that the Start for Life offer should include 6 universal services. Today, we've chosen not to focus on safeguarding and send services. We believe a baby and family-centred integrated approach will benefit both safeguarding and send, and they are both vital components of the Start for Life offer, but it is not as necessary to map a service progression in this way. Next slide, please, Paul.
So this was just to say, finally, before we move to the exercise, we want to obviously say a huge thank you in anticipation. We're hoping that we might have some time to come back to you at the end, but we're a little bit behind time. So if we don't, we'd like to give you the opportunity to engage with the evolution of our work. And if this is something that would be of interest to you, please do send your name and details to the chat function. So without further ado, we'll start going through the board. And I believe a link should now be appearing in your Zoom chat, which if you could click on, that would be brilliant. And we'll start to take you through a demonstration. So what's up on the screen at the moment, hopefully you're all able to get into the board as easily as possible. But Paul is just demonstrating what it is that you should be seeing here. So to get you familiar with the actual format of the Miro board, we've got a quick icebreaker for you here. So you can see a map of the UK and then a lot of post-it notes on the side of it. The colours don't mean anything as such, but obviously you can choose your favourite one. And we're hoping that you might be able to write what your role is in family help and move it to the correct place on the map. I should also say that you most likely will be seeing everybody's sort of guest names on the cursor. So if you can see on the screen here, Paul's just showing you which button to press in order to remove those names. So I think within your chat now, you should have links to one of 4 of these boards, because there's so many of you, this is all the same board, but we've just split them up. And so obviously you can pick whichever number you like, and then start to use this icebreaker session to get used to Miro.
I'm going to get my stopwatch on. Let's have 1 minute to do this.
Yeah, that sounds fine. So as you're inputting your post-its, we'll just give a little bit of a demonstration about how to use the rest of the board in the remaining time that we've got. So at the bottom of your map, you should see links to 4 different Miro boards. So whichever of these links you click on, I think there'll be a demonstration. It will take you to a table, which we should be able to see on the screen at the moment. Thank you, Paul. So this will take you to an example of one of the services as Phil previously outlined, so this one being maternity. And here you can input your examples of physical, virtual and outreach formats of the service through what you would see as being possible to deliver in a starting out, developing and a strengthened hub. You can move between the different boards based on those links at the bottom, which you should see with Paul demonstrating at the moment. Or if you are very tech savvy, you can zoom out and in, but I am not tech savvy, so this is the way that I would be doing it. Fantastic to see some people already populating. This is really helpful. And we've included some examples in the corner there just to stimulate thinking again. we're absolutely not precious on these being kind of conclusive positioning on the boards. We're just so keen for your ideas to go down there. Please don't worry about them being, you know, exactly right. Having these insights from you is incredibly helpful.
This is really cool to see already. So conscious of time. So, oh, look at that. That's really clever. Someone zooming around. Let's kick off. Put something in the chat if you're struggling and you can't work it out, and we'll come back to you. Oh, thank you, Paul. And we'll leave this up as a bit of an example, but really it's all about hearing your thoughts. As it's 22, we'll have, let's say, 6 or 7 minutes on this, and we will actually be able to keep these boards up for the rest of the day. So you'll have some chance to come in during the day if you have some free time, and pop some further thoughts as they come to you during the day. So I'm going to start my stopwatch now. We did think about having some background music, but we thought that might be a bit off-putting, so you have a bit of silence, and we'll come back to you in about 5 or 6 minutes. Thank you. Right. I think, oh, this is so amazing. I want to keep going all day, but I'm not allowed. We're going to wrap up in a second, so please keep going while I'm talking, as I say, for the rest of the day. So let's see if Molly can come back on screen. There she is. Thank you. So both of us just want to say a massive, massive thank you. This has been brilliant. The tech has worked, thank God. And this is kind of completely outdone my expectations about how it would work. So thank you. We thought we might summarize some of the themes, but I don't know if you're seeing what I'm seeing, but it all went a bit crazy and there's so much happening here. It's going to be quite hard. So something for us to go away and digest. We can see actually that there does seem to be a theme about really being clear that this isn't about discrete services, but about how the whole system integrates. And that is just amazing to hear, because that's exactly what we want to get across. These aren't discrete services, and the Start for Life vision is all about that integration and about everyone working together in the interest of the baby and the family. So thank you. Just a reminder, please pop your name and details in the chat if you want to carry on being part of this conversation and this work. So I'll just end and Molly will come back in, I think, and agree. Thank you from all of the Start for the Life unit. Thank you and goodbye. Have a lovely rest of your day and the rest of your week. Molly's not. You can say goodbye, Molly.
Yeah. Yeah, thank you so much, everyone. As Phil says, this has just been fantastic. A wealth of information, which is really going to help us develop our thinking. In the interest of time, I will pass back to Julia. Thank you very much.
Thank you so much, Molly and Phil. That was great. And thank you, everyone, for participating in that and sharing all of your insight. Thank you to all of our speakers from earlier this morning, and to Joe and Rachel, our amazing training team who are here in the background making everything happen, and the lovely Paul who's been navigating us through that Miro experience. Please do head over to our website if you want to book on any of the future learning events. Youth and Family Hubs on 10th of February, Service Design and Commissioning on the 3rd of March, Behavioural Insights on the 10th of March, and Supporting the Lives of Children and Young People with Special Educational Needs on the 29th of March. And we hope to see you here again soon. Thank you.